are here at the Deserve 2020, A Better Tomorrow Today virtual conference. And I want you to thank you first of all for doing this interview with us.
Absolutely.
Let the people watching know who you are, what your background is, and then tell them a little bit about what is PrEP.
Great. First, I want to say thank you so much for inviting me to speak. It's an honor to really be part of this, the presentation today. My name is Joshua Kies. I'm a family nurse practitioner, and I'm proud to say that I serve the community of Chatham County in Southeast Georgia and offer PrEP and PEP services. And I know that we're going to talk about that. I've been involved in HIV medicine for about 6 years. And again, I'm very passionate about HIV medicine. So you had mentioned what is PrEP. So it's a real loaded question. If we were to summarize what PrEP is a way that we can offer treatment to a patient prophylactically. So PrEP stands for pre-exposure prophylaxis, right? So all that means is that we're offering treatment to someone in the form of medication to help prevent them from getting or acquiring HIV, right? So before an action would take place that may put them at higher risk to acquire HIV. And the way that PrEP services are delivered across the US, it's really kind of like a protocol. It's a plan of care. So when most people think about PrEP, they think about medication. And yes, that's a part of PrEP, but also we develop, as practitioners, we develop complete plans of care. So we get to know our patients very well. Everything's confidential, you know, and we see how we can best meet their needs. So most of the time, when PrEP is delivered, there are two medications that we offer that the FDA has approved for PrEP, and those are Truvada and Descovy. Most people have heard of those, and they're very simple to take. It's one pill once a day. For maximum effectiveness, you want to make sure that you're taking it once a day, and you get maximum effectiveness after 30 days of taking the medication. So we have that slow kind of buildup of the levels in our bloodstream, right? Side effects of Truvada and Descovy, very minor, right? Normally, maybe some GI upset, so a little stomach ache, a little nausea. The nice thing about the PrEP protocols is that we get to see our patients at least every 3 months. And what we do on those monthly, every 90-day visits, let's say, is we reassess. Does someone still need to be on PrEP? But more importantly, we draw blood, right? And we make sure that there are no negative side effects to someone taking the medication, right? So if there are other options, right, that we have. But first and foremost, PrEP is all about patient safety. So from the provider perspective, we're making sure our patients are safe. And from the patient's perspective, they're making sure they're taking that proactive step to help prevent the spread of HIV and acquiring HIV.
I think that's a kind of good segue into the next part too. So as a part, like, why should it be an easy choice, or should they even consider, if you're sexually active, yes, PrEP?
Yeah, I think the question is actually a great question, because we're not specifically looking at any one community. We're looking at homosexual individuals, we're looking at heterosexual individuals, we're looking at just the population in general, right? And we need to make that distinction. There are still a lot of people that think that HIV only affects homosexuals, and that's just not the case. It affects anyone, doesn't matter. Skin color, the amount of money you have in your bank, makes no difference. Equal opportunity offender. So we need to make sure that we're keeping that in mind, and we want to make sure that that providers and that our audience is being proactive enough to kind of take that step to ask their provider about PrEP services. So I feel as a provider with years of experience that PrEP is an easy choice. I think the hardest part is to get patients in the door, right? Once we have them in the door, I kind of have a captive audience, right? But in order to get them in the door, we need to make sure that we're giving correct information to the community, right? One of the largest barriers that I've seen is people anticipating that PrEP is going to be very expensive. And if someone were to throw Truvada or Descovy into one of the internet search engines, it's going to show it's going to cost $3,000 a month, right? That's what it's going to show. However, everyone's financial situation is a bit different, but for about 95% of my clients, they qualify for an assistance program through the manufacturer of the drug. And what that does is it takes into account how much money the individual makes, right? And then there's some type of calculation that's done. And for, again, like I said, over 90% of my patients, their out-of-pocket cost for the medication is $0 a month. So it's literally free, right? So getting that information out, knowing that the manufacturers of these medications want to make sure these drugs are available to patients that may not otherwise have access to insurance, have access to a regular provider, is very important for the community to know. I also think that there's some misinformation also about long-term effects of some of the PrEP medications. And I want to make it very clear that when someone is enrolled and actively participating in a PrEP program, that they will be seen by their provider every 3 months, and blood will be drawn. We're going to make sure that all of their body systems are working just as they should. And if they're not, we can intervene early. A lot of the information that's being put out there on the web about some of the PrEP medications are people that were on medications long-term with no routine follow-up, and that's a problem. So I feel that nationally that's been addressed, and now we're moving forward. From a barrier perspective, I think we've overcome a lot of them. It's just getting the right information out there in order for people to make that step to walk in the door.
And that's very, very huge. And I'm actually glad you talked about that, because a lot of times, I can remember who I was talking to a few weeks ago about something similar in the healthcare and medical providing world, that a lot of times there's not only a lot of misinformation, but people don't know about these programs that are out there to help them, especially depending on their situation. And sometimes it may be just, a lack of them knowing to think to ask, but then sometimes the provider or the practitioner doesn't tell them either.
Absolutely, and I think we'd be remiss if we didn't mention that there is a stigma associated with asking anything about HIV, right? So there will be general assumptions made about someone's behavior, possibly, if someone asks that question. So we need to have those conversations, and I'll talk a little bit later in the presentation about that, but we need to make sure that we're talking openly and honestly to our provider, and each person is responsible for their own health, right? So if someone's taking the step to be proactive, to try to not get HIV, if you're hearing from your provider that you don't need to be worried about HIV even though you're sexually active, it may be time to look for another provider, right? So we want you to be proactive. We have all the tools necessary to make you succeed, right? We just need to have the dialogue in order for it to happen.
And speaking of dialogue, when you hear the phrase, I dream, I speak, and receive victory, what first comes to your mind?
When you say that, I actually get chills, because it's hope is what comes to mind. There's a lot of hope. If we're looking specifically at HIV, whether someone currently has HIV, if they're involved in a PrEP program trying to not get HIV, there's hope. We're making drastic steps in providing up-to-date, evidence-based research care to our patients. Our modes of providing that care are changing on a daily basis as we get new research in. So not only are patients being proactive right now, but providers are being proactive as well. So again, I think hope. I truly believe as we look forward into the next decade, that if we don't have a cure for HIV, we'll be really close. So we need to hang on, and we need to do everything we can to get the transmission rate at this point today down to 0, right? We're not there yet. We're getting the tools in place to get there. So we need to work those tools and utilize those tools the most effective way possible. But if we're looking forward 10 years, I really feel we're going to either be there, we're going to be very close to a cure. And we just need to hold out until then.
Josh, thank you so much for doing this.
Absolutely. My pleasure. Thank you.